to talk a little bit about exercises to help strengthen the knee joint. And I understand where this question comes from. I get this question so often. Sometimes people will say more specifically exercises to strengthen the quad. This question came in exercises to strengthen the knee joint. And I definitely have exercises to strengthen the knee joint. But my first question to somebody who asks me that is, why do you want to strengthen the knee joint? What is it about the knee joint that you think you need to strengthen? Like, why is it the knee joint that you need to strengthen? And the reason I ask that is because for most women with knee arthritis and knee pain associated with the arthritis, it's usually not until further down the road that we actually start looking at strengthening the knee joint itself. As a physical therapist, I learned from schooling, from treating patients and clients, that yes, the knee hurts, but let's think about what we have to be able to do. What is it that we're doing that hurts? Is it walking that hurts? Is it climbing stairs that hurts? Is it getting up and down from the floor that hurts? Is it just standing that hurts? Because not the only motion, the biggest motion the knee does is bend and straighten. So in anatomical terms, we call that flexion to bend and extension to straighten it out. That's what the knee does. So we don't necessarily need to strengthen the knee joint to get rid of the pain, because we want to look at everything as a whole. When we're walking, we aren't just bending and straightening the knee to be able to walk forward without falling over. We need to engage our hips so that we don't walk with a waddle. We need to engage our hips so that we don't lose our balance. We need to engage our core so we don't lose our balance. We need to strengthen our ankles so that we can propel ourselves forward. We also need to strengthen our hips to pull ourselves forward. So there's a difference there. Ankles push us forward, propel us forward. Hips pull us forward. Knees help make us so that we don't look like the Tin Man when we're walking. So we don't necessarily have to strengthen our knee joint if we have knee pain. And I actually find that most people who have knee pain should not start with exercises that strengthen the knee joint. They should start with exercises that are either above or below the knee. So that's at the ankle and foot or at the hip. So some of you in this group are part of my exercise group that I run every month. And if you are part of that group, you probably noticed in the beginning, we didn't do any exercises that you think of to strengthen the knee joint. For the first probably 6 weeks, maybe even, I'd say 6 weeks, we just started doing mini squats, and we started the class officially started in March. So the people who are in it have been with me since the beginning, and we just started doing mini squats, and like small, we're talking mini. And that's an exercise that people think of to do to strengthen the knee joint. But you have to look at the other places first. So one, the hip pre-positions where the knee is in space. So if our hips are weak, that's going to make us waddle and, do the shifty hips as we walk. And if we're having shifty hips when we walk, that's going to put different pressure on our knee, because we're not necessarily walking in a straight line. We're kind of meandering, even if it's small amounts. And that means that the knee is going to take more pressure on the inside or the outside of the knee, depending on which leg it is and how you're walking and everything. So strengthening the knee isn't going to make it hurt less when you're walking if it's a hip problem. Well, and then let's look down at the feet. Do you have really flat feet? Really flat feet can affect the knees as well. So if we strengthen the knee joint, but we have flat feet, that's not going to help us either, because we're still going to have flat feet, which are going to make our arches collapse, which is going to bring our knees closer together, which is going to put a gap on the inside of the knee, compress and tighten down the outside of the knee. So then our IT band's going to get tight and sore. But strengthening our knee joint is not going to get rid of any of those pains, because it's not where the strength problem is coming from. I wanted to share that because a lot of people will ask me, what exercises can I do to strengthen the knee joint? And if you're having knee pain, I really don't recommend you strengthening the knee joint. Strengthening the quads and strengthening the hamstrings is not going to support your knee the way you think it will. You need to strengthen your hips and your ankles, because your knees are sandwiched in between those two. And so if one of those or both, and it's usually both, are weak, your knee's going to take the brunt of that force, and it's going to have to figure out what to do. And so it's going to change positions on what we call the frontal plane, but on the in or the out position. So you're going to be either knock-kneed or knee or bowed, and strengthening the knee joint wouldn't help that. Strengthening the knee joint is very helpful to help you get up from a chair, to get up and down the stairs, and those are very important things. But those kinds of exercises don't necessarily help with the problem that somebody's having. So we just need to dive deeper into it, and we can't just think, oh, I have a knee problem, I need to strengthen my knees, because it's usually not that simple. So that's about knee strengthening.